the silent struggle no one talks about. Most people don't talk about it. But if you've spent time around older adults, a parent, a spouse, even a grandparent, you may have quietly noticed an unpleasant, lingering smell of urine. It's not something anyone likes to mention out loud, but it's real. And for many seniors, it becomes a silent source of shame and embarrassment. Today on Wisdom and Stillness, we're gently uncovering the 7 most common hygiene mistakes that often lead to this issue, not to blame anyone but to help restore comfort, dignity, and confidence in daily life. Whether you're a caregiver or a senior yourself, you deserve peace, and that starts with small, caring changes. Mistake number 1. Forgetting the invisible zones during bathing. We often think a quick shower is enough. But for seniors, especially those with limited mobility or energy, certain areas of the body don't get the attention they need. Behind the knees, under the breasts, between skin folds, around the thighs. These invisible zones can trap moisture, sweat, and urine, especially if there's incontinence. Over time, bacteria grows. And that's where odor begins. The fix? Use a warm washcloth or gentle cleansing wipes for these areas during daily care. It doesn't have to be harsh, just thorough and kind. Mistake number 2. Reusing clothes without a fresh wash. We've all done it, wearing pajamas or a robe for an extra day. But for seniors, this can quickly lead to lingering odor. Urine leaks are often light and may not leave a visible stain. But they do soak into fabric, underwear, nightgowns, pants, even socks, and over time the smell gets locked in. Tip: set up a routine laundry schedule, even for clothing that looks clean. Use unscented, odor-neutralizing detergent. Add white vinegar to the rinse cycle for natural freshness. Mistake number 3. Skipping perineal care, especially after leaks. This one's sensitive, but crucial. The perineal area, between the genitals and anus, is where urine can accumulate, especially after accidents or small leaks. If it's not cleaned gently and consistently, odor will follow, even after a full shower. This isn't about lack of care. Often, seniors just don't have the flexibility or strength to do this properly. Solution: use soft, fragrance-free wipes after every episode of leakage. Consider a peri bottle with warm water for a gentle cleanse. And don't forget to pat dry. Moisture breeds bacteria. Mistake number 4. Using harsh soaps that disrupt skin balance. Many think, the stronger the soap, the cleaner the skin. But harsh, heavily perfumed soaps can actually cause more harm. They strip the skin of its natural oils, leading to dryness, cracking, and irritation, which in turn can trap odors instead of removing them. Better choice? Use a mild, pH-balanced cleanser made for sensitive or aging skin. These support the skin's barrier while still keeping it clean. Infection or UTI. UTIs are incredibly common in seniors, especially women, and they often go unnoticed because the symptoms can be subtle. If you notice a sudden, sharp odor or if your loved one seems off, talk to a doctor. Treating a UTI can remove the smell and improve overall health and mood. Mistake number 7. Relying only on perfumes or air fresheners. We get it, you want the room to smell nice. But simply spraying perfumes or plugging in an air freshener doesn't solve the root issue. In fact, it can mask the odor temporarily and make it worse over time. It's like spraying perfume on sweaty gym clothes. It doesn't fix the problem. The better approach: focus on removal, not just cover up. Clean surfaces. Wash fabrics. Address the cause. Then add a mild, clean scent, like lavender or lemon, to create a peaceful environment. Practical solutions that actually work. Here's a quick summary of things that can truly help. Use gentle, fragrance-free wipes after any leaks. Wash clothes after each wear, especially undergarments. Change bedding and cushion covers frequently. Switch to skin-friendly cleansers. Encourage a regular shower or sponge routine. Add white vinegar or baking soda to laundry. Keep hydrated. Concentrated urine smells stronger. These small habits add up, and they make a huge difference in the daily comfort and confidence of seniors. A word to caregivers: compassion over judgment. If you're caring for someone, remember this issue is not their fault. Aging changes everything: mobility, memory, sense of smell, even the ability to notice when something's wrong. What they need isn't correction, it's compassion. Your patience, your care, your quiet help behind the scenes. It matters more than you know. Dignity in every detail. We all deserve to feel clean, respected, and comfortable, no matter our age. When we address these simple hygiene mistakes with love and awareness, we don't just remove odor. We restore dignity. Thank you for watching Wisdom and Stillness. If this video helped you, consider sharing it with someone who might need it. And as always, stay gentle, stay